नमस्ते बिटिया, हमेशा खुश रहो बिटिया। Myself JV'n Dr. ASTHA SIKARWAR, Assistant Professor, Department of Organ of Medicine, Faculty of Homeopathic Science, JAYOTI VIDYAPEETH, Women's University, Jaipur. Today's topic is from JT Philosophy, Characteristics. As in aphorism number 146, the third point in the duty of the physician is to employ those medicines whose pure effects have been proved upon a healthy person in the manner best suited to the cure of natural diseases homeopathically. As in aphorism number 147, of all these medicines, that one whose symptoms bear the greatest resemblance to the totality of those which characterize any particular natural disease ought to be the most appropriate and certain homeopathic remedy that can be employed. It is a specific remedy in this case of disease. There are no specifics in homeopathy except at the bedside of a patient when the remedy has been wrought out with great ardor and care. Then it may be said that medicine which is found to be similar to the symptoms which characterize this disease in his specific. Now, please note that there is an emphatic sense in that word characterizes. It is no ordinary expression. We have read in the earlier portions of the organon that the disease makes itself known to the physician by sign and symptoms, and that the totality of the symptoms is the sole representation of the disease to the physician. But that totality has to be studied to ascertain what there is among all the symptoms that characterizes the disease or marks the symptoms as peculiar. Now Hahnemann commences to analyze the totality of the symptom for the purpose of giving it character. It has been said in these lectures that it is necessary to do that the information that leads up to characterizing is really the information that makes the homeopathic physician wise, by which he has the ability to intelligently understand that which he has to treat. That medicine which is best adapted is the most similar, but you cannot demonstrate beforehand that it is the specific homeopathic remedy, for you may be deceived in your idea of the nature of the case. But when that remedy has acted, then it may be seen that that remedy was homeopathic or specific, or that it wasn't homeopathic. You have no idea as to what remedy will be homeopathic to the case until you have examined all the symptoms and then proceed to find out that which characterizes. In the case of the remedy, ascertain that which characterizes it, and in the case of the disease, that which characterizes it. When these two occur before the perception, before man's mind, so that we can think upon them and see what characterizes each one of them, and he realizes that the remedy is the most similar of all in the materia medica, then he is assured that that remedy will cure, and it only requires to be administered to prove that it is the specific. The homeopathicity is thus sustained. The similitude has been borne out to be the medicine having cured. We cannot have the demonstration that the remedy is homeopathic until it cures the sick man. We may only presume that it is homeopathic, or say it appears to us that it is homeopathic, because that which is characteristics to of the disease is most similar of all other things to that which is characteristics of that remedy, or vice versa. We may reasonably assume that that remedy is the specific, but the homeopathicity can only be demonstrated by cure. So it does not make a remedy homeopathic simply to be carried in my case. Homeopathic remedies are not homeopathic remedies simply because they have been used by a homeopath. Remedies are not homeopathic because potentized and attenuated or prepared after the fashion of our school. What constitutes a remedy homeopathic? The answer is it has demonstrated its curative relation to the patient after having been prescribed in accordance with his symptoms, the recovery taking place in the proper direction from above downward, within out, and the reverse order of the symptoms. That constitutes a remedy homeopathic, and that constitutes the prescription homeopathic. It is then a specific remedy, and in no other sense can a remedy be called a specific. Hahnemann gives his theory of cure in paragraph 148, but you are not compelled to adopt it. Hahnemann himself says it is only a theory and he offers it as simply the best in view, but not as binding upon you to accept. But in paragraph 149 is something that must be accepted, that is, it must be known and then accepted because it is true. It is a general statement of the results of the homeopathic remedy in the cure of disease. The rejection of this paragraph must effect a separation among us, those who do not believe and those who believe. When a proper application of the homeopathic remedy has been made, the acute disease which is to be cured, however malignant and painful it may be, subsides in a few hours, if recent and in a few days, if it is somewhat older, etc. From this, I am placed under the plain necessity of acknowledging that if under my treatment such diseases do not subside, I haven't found the right remedy. That will force the honest homeopathic physician to seek the proper remedy. Let not the blame be placed upon the failure of the system and of law and order, but let it be placed upon the who practices it. Just so sure as you find the homeopathic remedy in a case of scarlet, just so sure you will see that fever fall and that child improve. While the rest will remain out, nothing of the malignancy of the case will remain. In an ordinary case of scarlet fever, we find that in a few days the child is so much better he wants to go to school. But then we treat the child and not the fever. Just so sure as a physician has in mind the rash of scarlet fever or of measles as the main element of the disease, he will make a failure and the patient will not recover so speedily. But as a matter of fact, the homeopathic physician prescribes for the patient on that which characterizes the sickness, even though it be what is called a self-limiting disease. In aphorism 150, this treats of one of the difficulties we have to contend it. If a patient complains of slightly accessory symptoms which have just appeared, the physician ought not to take this state of things are a perfect malady that seriously demands medicinal aid, etc. It is right for you when your patients are under constitutional treatment to prescribe for a cure cold, but only when it is not an ordinary one. If the cold is likely to cause serious trouble, then you must prescribe for it. Slightly indisposition, however, should not be receive remedies. You will have patients that will come to you at every change of the wind, at every attack of snuffles the baby has, at every little headache or every little pain. If you then proceed to change your remedy or prescribe for each one these little spells of indisposition, you will in the course of a little while have such a state of disorder in the individual that you will wonder what is the matter with this patient. You had better give her no medicine at all, and if she is wise and strong and can feel confident, you can say to her that she does not need medicine for this attack, but occasionally give her a dose of constitutional medicine when these little attacks are not on. While you are young and cannot hold this patient with an iron grasp, then you come to you when they come to you, you had better give them placebo and let the indisposition pass off itself. Watch it, however, and it may at the close develop some constitutional manifestations and throw light upon the patient that you have been treating. On the other hand, it is an easy matter to prescribe for severe acute diseases. They are decisive, they are strongly manifest, they are symptoms, they are sharp cut in their expression, the symptoms are prominent, and you will not be confused as you will be in the slight indisposition. The slight indispositions are nondescript. You don't know what to do for them. In vain you seek to find that which characterizes them, and hence it is doubtful about any remedy that is administered being of any value. You will be astonished after prescribing a number of years and your patients have gained confidence in you that when they come in with these travel ailments, what they won't have them after a few powders of sugar, as in aphorism 151. But if the few symptoms of which the patient complains are very violent, the physician who attentively observes them will generally discover many others which are less developed and which furnishes a perfect picture of the malady. This session powered by digital version 2.0 Jyoti Vidyapeeth Women's University. I hope you are satisfied with my digital session. If you have any query, please mention it in comment box. I will resolve it. Thank you.